हेलो फ्रेंड्स, वेलकम टू माय चैनल। और आज हम डिस्कस करेंगे जनरल एनाटॉमी के एमसीक्यूज़। अगर आपने पार्ट 1 नहीं देखा है तो प्लीज़ देखिए, डिस्क्रिप्शन बॉक्स में लिंक दी हुई है। अगर आप चैनल पे नए हैं तो प्लीज़ सब्सक्राइब द चैनल एंड लाइक द वीडियो। लेट्स स्टार्ट। क्वेश्चन: इट इज़ द ब्रांच ऑफ सिस्टमिक एनाटॉमी विच डील्स विद द स्टडी ऑफ वैस्कुलर सिस्टम। ऑप्शंस: ऑस्टियोलॉजी, एंजियोलॉजी, मायोलॉजी, न्यूरोलॉजी. Option B is correct, angiology. Next, it is the study of prenatal and postnatal developmental changes in an individual. Options: histology, radiology, embryology, myology. Option C is correct, embryology. Next, it is a lying down position with face facing downwards. Option: supine, lithotomy, anatomical prone. Option D is correct, prone. Next, a vertical plane at right angles to the median plane is called as. Options are median, sagittal, coronal, transverse. Option C is correct, transverse. Next, it is the rotation of the forearm so that the palm is turned backward. Options are pronation, flexion, adduction, supination. Correct answer is pronation. Next, it is the fibrous band made up of interdigitating fibers of the tendons or aponeurosis. Options are ligament, belly, sheath, raphe. Option D is correct, raphe. Next, it is a suffix used to indicate removal of the part or organ from the body. Options are ostomy, otomy, ectomy, oma. Option C is correct, ectomy. Next, number of bones present in the appendicular skeleton both sided is. Options: 80, 126, 206, 216. Option B is correct, 126. Next, which of the following is an example of sesamoid bone in the human body? Options: ribs, patella, sternum, vertebra. Option B is correct, patella. Next, which of the following is pneumatic bone in the human body? Options are maxilla, femur, lacrimal, mandible. Option A is correct, maxilla. Next, which type of bone is characterized by presence of Haversian system? Options are cancellous, fibrous, compact, trabecular. Option C is correct, compact. Next, which of the following is an example of hyaline cartilage? Options: costal, intervertebral, ear pinna, auditory tube. Option A is correct, costal cartilage. Next, which of the following is an example of fibrocartilage? Options are menisci, articular, auditory tube, bronchial. Option A is correct, menisci. Next, which of the following is an example of elastic cartilage? Options are auditory tube, menisci, costal cartilage, tracheal. Option A is correct, auditory tube. Next, all of the following are subtypes of fibrous joint except. Options are suture, symphysis, gomphosis, syndesmosis. Option B is correct, symphysis. Next, all of the following are examples of secondary cartilaginous joints except. Options: symphysis, intervertebral, gomphosis, manibrio. Option C is correct, gomphosis. Next, the term synchondrosis is used to describe the anatomical configuration of joint. Options are primary cartilaginous, fibrous, secondary cartilaginous, synovial. Option is A, primary cartilaginous. Next, which of the following is classified as a biaxial variety of synovial joint? Options: pivot, saddle, ellipsoid, spheroidal. Option C is correct, ellipsoid. Next, the average diameter of capillary is about micron. Options: 50 to 100, 25 to 30, 6 to 8, 40 to 50. Option C is correct, 6 to 8 micron. Next, which type of muscles in the living body are supplied by cerebrospinal nerves? Options: smooth, cardiac, skeletal, all of them. Option C is correct, skeletal muscles, nerves. Circulation maintained through anastomosis is called as. Circulation maintained through anastomosis is called as. Options: pulmonary, systemic, portal, collateral. Option D is correct, collateral. Next, which of the following works as a central lymphoid tissue in the body? Options: spleen, bone marrow, lymph node, epithelium. Option B is correct, bone marrow. Next, the neurological cells having star shape because of their numerous processes are called as options: microglia, glioblast, astrocytes, oligo. Option C is correct, astrocytes. Next, which cells are concerned with exchange of materials between brain and CSF? Option A is glial, option B is ependymal, option C is astrocytes, and option D is microglia. Option B is correct, ependymal. Next, which cell are responsible for take-up and storing of neurotransmitter? Option A, glioblast, microglia, glial, astrocyte. Option C is correct, glial cells. Next, which cells are responsible for production of histamine? Options: plasma cell, mast cells, macrophages, adipocytes. Option B is correct, mast cell. Next, which of the following cell is phagocytic in nature? Options: mast cell, lipocytes, plasma cell, macrophages. Option D is correct, macrophages. Next, Wharton's jelly of umbilical cord is an example of which tissue? Options: mucoid, adipose, pigment, fibrous. Option A is correct, mucoid tissue. Next, which fibers of connective tissue are responsible for formation of supporting framework of organs? Options: actin, choline, reticulin, elastin. Option C is correct, reticulin. Next, the skeletal muscles which brings about desired movement is called as options: fixator, synergist, agonist, antagonist. Option C is correct, agonists. Thank you for watching.